Hello everyone and welcome to Module 3, ACT. The first step in ACT is to call 911. It is important to remember to try and stay calm. When you're on the phone with the 911 operator, state, "There is an unresponsive person at this address. I need an ambulance." The next step in ACT is to administer naloxone or Narcan. To administer naloxone, you will have your naloxone nasal spray. It looks like this. Peel back the packaging. Place your pointer finger and middle finger on either side of this plunger. And your thumb on the bottom of the plunger. Now place this nozzle, top here, in their nose. Pick one nostril or the other and gently push it until your fingertips touch the bottom of their nostril. And then you use your thumb to release that dose of naloxone into their nose by pressing up on that plunger. This is a one-time use dose. When you press that plunger up, you'll see it disappears. Now that dose of Narcan has been administered, and this is trash. Again, you can repeat a dose of naloxone every 2 to 5 minutes, depending on the signs and symptoms that we discussed in Module 2. When you administer your second dose, remember to switch nostrils. The next step in ACT is to perform rescue breathing. We are going to watch a video with rescue breathing.
How to respond to a suspected opioid overdose and administer naloxone. Signs of an overdose are unconsciousness, fingernails or lips turning blue, slow or shallow breathing. Immediately call 911, report location. If overdose is suspected, try rousing them verbally. If this doesn't work, vigorously grind knuckles into the sternum. If no response, make sure the airway is clear. Administer one dose of naloxone. If they don't respond within 2 minutes, administer the second dose. If no response, get them to a flat surface, provide rescue breathing. Tilt head back, pinch the nose, and put your mouth over there.
Perfect. So, first step, lay them flat. We're going to tilt their head back and lift their chin a bit. Now, the goal of this is to provide an even plane for that breathing, that breath to get into their lungs. So we don't want them like this, and we don't want them hyperextended like this, because it's going to make it harder for that air to get from their mouth to their lungs when you're performing rescue breathing. So just make sure that when they're lying flat, it's an even plane, just like that. Open airway. Next, you can place a protective barrier if you have one. This shield is a one-way shield. So if they have vomit or secretions, they won't get back onto you when you're performing those breaths. Pinch their nose shut. You take a deep breath. Seal your mouth over theirs or over that protective barrier. And then blow that breath into their mouth. You should be able to see their chest rise. So if you divert your eyes to look at their chest as you're blowing into their mouth, you should see some chest rise. Now, you and I breathe about 10 to 20 times a minute, depending on what we're doing. You can repeat a breath every 5 to 6 seconds. You don't have to get your timer out. The goal is to help assist them to breathe, to get breaths. Make sure that you're breathing for yourself also, not getting dizzy or lightheaded, but just every few seconds, give them a breath and also make sure that you are getting breaths for yourself. Let's do a quick knowledge check. Each intranasal naloxone device is good for blank dose. If you said 1, you're right. Intranasal naloxone can be given every blank minutes, as needed based on symptoms. 2 to 5 minutes. 3 key signs and symptoms of an opioid overdose include blank, slowed or stopped breathing, and blank. Decreased alertness. Pinpoint pupils. Blank safety is #1 priority. Your safety. Give a breath every blank seconds during rescue breathing. Every 5 to 6 seconds. That concludes Module 3 ACT. We hope that you enjoyed this module, and we'll see you in Module 4.